maybe at home, or if it is not your home, I'll say when you're visiting your nani badi or the grandfather's place in the room. We all know what this picture is depicting basically. You know, there's a famous mantra, Shantrakaram Bhujakshayanam Padmanabham Suresham Vishwadharam Gagan Sadashyam Meghvarnam Shubhangam Lakshmikantam Kamal Nayanam Yogir Vidya Nagamyam Vande Vishnu Vaivahram Sarva Lokekanatham. Means from the Vishnuji's umbilical cord, the Brahma is taking a origin, and then Brahma, as we know from our Hindu Shastras or the Sanatan Shastras, the Brahma created the entire universe. So it dates back to so long back that umbilical cord is having the generating power. So now what exactly are the exosomes? Exosomes are basically a bilipid structure molecule which is having inside there's a plethora of I'll say growth factors, peptides, microRNAs, mRNAs, signal molecules. So what these things are doing, from our basic knowledge we know it is for cell to cell communication only. But apart from cell to cell communication, it is having other functions also, which I'll be going to subsequent slide. The diameter of an exosome is between 30 to 150 nanometer. If any molecule which satisfies this criteria of size, and there are other criteria also, then these exosomes are used for therapeutic use. Now, how these work? Exosomes are the nano-sized particle. Either they are uptaken by the recipient cells, or there could be a cell-to-cell fusion, then dissolution of the membrane and the cargo get delivered inside the cell, or the cell did do endocytosis and the entire molecule becomes the part of cell, and it carries out it works after delivering all the cargo inside the cell, and it is going to do the various protein synthesis and the cell functions properly. Now we all know the role of exosome is cell to cell communication, but apart from communication, what it is also having, it regulates cellular behavior also. It causes stimulation of the cell growth and proliferation. It triggers angiogenesis. It has a potent anti-inflammatory effect also. And it can modulate your immune response too. Along with that, what it is doing, we all know it is transporting all those materials which is already loaded inside it. So these are the functions of exosome. Now coming to the source, it could be a plant source, as I was telling, it could be an animal source, or it could be a human source. So we all know plants will be talking better to the plant, animals, one-way communication to the animals, but we all are human doctors. We have studied only human beings diseases. We haven't studied, unless until I am a botanist or a zoologist or zoologist who will be studying those things. So a animal source, a human source exosome can better way communicate to the human beings only. So that is the main reason for me to use human derived exosomes. Now we all know what is this picture. Can anyone? Yes. Pufferfish. We all know that this pufferfish contains tetrodotoxin, a substance that can make a foul tasting and often lethal to fish. To human, tetrodotoxin is deadly up to 1200 times, which is enough toxin in one pufferfish to kill 30 adult human beings. So it could be a dangerous animal source. And similarly, there are over 700 species of plants in the US and Canada, also known to cause illness at one time or the other. A database focusing on the Central Europe included 844 plant species which contain phytotoxins, so many phytotoxins. So it's better and safe is a human driven stem cells, and from those stem cells, those exosomes will be much better for the human beings. Now coming to a bit of potency, we all know, we must have read even our anatomy, you know, the totipotent cells. The totipotent cells are the cells which will keep on dividing and differentiating till a full organism is born. Then coming to a pluripotent stem cells will also divide and differentiate. It will keep on doing that unless until a full organ is formed. Then comes a multipotent. It can have all the three lineages, but it's a limited, either a mesenchymal stem cells or a hematopoietic stem cells. So they can form bone, blood, cartilage, etc. Oligopotent, only few cells types only, like within a lineage, like a lymphoid or the myeloid tissue. And unipotent, only one specific cell types, as the muscle stem cells or the skin. Why this potency is important? Because depending upon the potency, which is the power to differentiate and divide, those exosomes will be accordingly behaving like that only. Coming to a very simple thing, I'll say, when we were very kid, maybe a toddler, sir, I know you were very enthusiastic and a good runner, but what happens? The potency and the power, as we age, what it decrease. It's same. I was also like that only. I used to run here, there. My mother and father can't used to control me. Sometimes I'm here hiding, running there, because my potencies were very high. But as we age, what happens? Everything get decreases. So the source is very important. Now we all know, as we adult, the source of stem cells are limited. Either the myeloid, that is a hematopoietic in the bone marrow, or the adipocytes. We all are plastic surgeons doing lot of regenerative treatment by doing fat grafting, utilizing the mesenchymal stem cells which are present around the adipocytes. Then in the dental papilla as well as in the hair follicle. These are the four sources. But apart from that, there is one more is there. We can induce iPSC. You can induce pluripotency in any of the cells, because of the technology. But coming to the parent thing, we have these three sources. Now what happens legally, if somebody wants to donate his or her fat, the legal age is 20 years, but in our country there are no norms, no law at what time you can donate, so that you can culture the stem cells. From those stem cells you can derive the exosomes and you can use. But in Korea and other countries there are legal laws. So 20 years is the age. Healthy adult, after filling all the criteria, they undergo a liposuction by a plastic surgeon, and then all those things are done. So then what happens? The exosomes are 20 years aged. Clear? Then second is bone marrow. Bone marrow, again legal age is 18 years to donate in USA, but in our country again the law is not there, sir. And who wants to have that pain of taking bone marrow and then getting it cultured and then you ultimately harvest? But the problem is that in bone marrow, 80% of the stem cells are hematopoietic. 90%, 80 to 90% are hematopoietic. Only 10% are mesenchymal stem cells. So what happens? The source becomes limited, and again that is 18-year-old exosomes we will be having. And you forget about the dental. Who is going to say कि आप मेरा दांत उखाड़ो और उसमें से निकाल के कल्चर करो? नहीं, वो नहीं होगा. Here, those who are doing hair practice, I think they must be knowing a recent thing which I have also started doing a hair follicle stem cell culture. It could be a alternative to an hair transplant surgery in future. I hope all are aware of this. No, we'll discuss later on regarding this. Let's come back to it. Again the source. Then coming to the very aged, if we can catch hold of the blastocyte when the ovum and sperm is meeting, and then blastomere is there and it is having the highest potency. So if I am culturing that and then having then exosome, then theoretically maybe I'll be having some tumorigenicity also, because as I told you, the what you call this thing, totipotent, these are totipotent cells, so they keep on dividing, so exosomes may have. And moreover, who you will get only accidentally those who are getting aborted, or experimentally only you will be having. But I think that is having a legal issue. Then comes what? A baby is surrounded by an amniotic fluid. So in amniotic fluid also we are having a stem cells. So, and but those stem cells are pluripotent stem cells. So pluripotent means they are again very potent, but they can keep on dividing up to an organ. So in order to harvest, you have to do an amniocentesis. But amniocentesis is also having a problem. Nowadays, what is happening? We are not having multiple children. Each and everyone is having either a single, or I'll say maybe having a bit broad mind, they can accommodate 2 children. So all the children who are before born, when inside the mother's womb, they are very, very precious. No mother, when a doctor will say, I'll do an amniocentesis and there's a 1% chance you will have an infection or abortion, nobody will. But in Korea, still there are norms. So they do amniocentesis also, and then again those things. So the exosomes driven from the amniotic fluid will be having a theoretical again chance of oncogenicity. So these 2 sources are gone. Adult, I already told you, they are of the adult variety. So what is left? When a baby is born, mother is safe, baby is safe, umbilical anyway you are going to dispose by a biomedical waste. So it's a wastage thing. So umbilical cord. So there are guidelines. The mother who is willing to donate her umbilical cord for research purpose, that is means for culture of stem cells and subsequently exosomes, they fulfill the criteria and they're willing. So only those mother undergoing cesarean section, not even spontaneous vaginal delivery, so that the contamination is least or minimal or zero. So they will undergo cesarean section, and then only that umbilical cord will be taken. And then that umbilical cord in a lab undergoes various tests, various examinations. Then only their stem cells, which are present in the Wharton jelly, are cultured. And in the culture media, we isolate exosomes, and when they fulfill all the criteria, they come for clinical use by the aesthetic surgeons or the aesthetic dermatologist. So in one word, we can say whatever we have seen, the source is very important first. So we discarded the animal source, we discarded the plant source, we switch over to the human source. In again human source, why not the adult one? Going to the science, the umbilical cord will be having the highest vigor and highest potency in all those, be it's a growth, be it's an angiogenesis, be it's a anti-inflammatory, or in a modulation of a immune response. And this is a term parabiosis. You know about parabiosis? There was a famous experiment in which what it was being done, a adult or a grown-up mice blood was replaced by a young mice. And what happened? The older mice behavior changed. It becomes more energetic. And the reverse happened to the younger. And when reverse was done, the reverse happens. So it was an experiment. And if you go to history, there are, so many things about the blood also. If you delve into these things, especially, I don't know, in my country was there, in Egypt, and those things, the blood related things were there. And if you want to know more about the studies which are already there in publication, you can catch hold of Jessica or Shubham. They can tell you about the various studies are there. You can read those articles. Now coming basically to the where plastic surgeons can use exosomes in their clinical practice. I will say plastic, I haven't said aesthetic surgeons. Both, because plastic surgery will contain all entire umbrella. You will be having a reconstructive part, you will be having an aesthetic part also, and in that also non-surgical aesthetics also. The wound healing, we all know, sir can vouch, plastic surgeons are the authority for any difficult wound. Whoever the fraternity is there, be it an orthopedician, be it a neurosurgery, be gynecology, be ophthalmology, anything, when the wound, or cardiothoracic surgeon, So any difficult wound are best managed by the plastic surgeons. And you know, at times in our OPD also, sir, we get a very simple thing, sir, जल गया क्या लगाएं, क्या मल्लम लगाएं. And you know, Silverex ही आँख बंद के निकलता है. But I'll tell you, Silverex third class होती है. Being a plastic surgeon, I don't know कितनों ने use किया है and how cumbersome is to apply. रोज कम लगाओ घिसो Silverex. अरे कुछ और दीजिए ना. Give something which expedites the process of healing. Am I right? Mane, you want to expedite, and along that, what you have to do? It will be less scarring, less inflammation, and better aesthetic outcome. So we are having a molecule, we can utilize the potency which Exosomes is also having, just mere a topical injection. I think you all know, na, in difficult wounds, you have injected PRP in varicose vein. What we are utilizing? The growth factors. And there is a study, and there are papers also, which shows that the exosomes are around 150 to 200 times stronger than the PRP in doing all the regenerative. Coming to the ladder of, I'm just a bit digressing it, coming to the ladder of regenerative medicine, the basic is PRP, a better formulation you can say GFC. We were discussing, Dr. Saab, we were discussing na PRP versus GFC. Then exosomes, then comes your other things. If at all you believe the plant mimetic, those things are there. I don't believe, so I don't use in my clinical practice. I prefer a human things for the human beings also. Then we have that SVF, you can do liposuction, utilize for the growth potential or a regenerative potential, whatever it is form. Then if you can catch hold of the stem cells, if the day stem cells will come in our aesthetic practice or in the medical practice, I believe that the humans will become immortal. Sir, do you agree? No. Anyone agree with me? No.
You should not become immortal.
But I am telling you, the man who is going to live for more than 150 years is already born. And one day human being will be immortal unless and until two things happens, either disseminated disease, clear, but you can recreate. I'll take out 𝗕𝗲𝘀𝗁𝗁 stem cells, store, and next 𝗕𝗲𝘀𝗁𝗁 will be there, practicing in Pune only. So anyway, so wound healing. So it enhances tissue regeneration and repair by suppressing inflammation. Anti-aging treatment, of course, we are into aesthetics. So it promotes collagen production, angiogenesis, and stimulates stem cell proliferation, leading to skin rejuvenation. Pigment regulation. It regulates melanin production pathway and activates melanocyte precursors to differentiate into mature melanocytes. So here I'll say the exosome will be working for hypermelanosis also, and it will be working for vitiligo also because of the immune modulation effect. Clear? Then obviously what is left is hair. Who doesn't love hair? Everybody wants to have hairs on their scalp. जिसके सर पे बाल नहीं होते ना वही दर्द समझता है, बाकी दूसरा ना समझता नहीं है. You understand? They will be investing so many things on the internet, this doctor, homeopathic, then they'll end up with a plastic surgeon. Sir, now you do something and do some hair transplant. So before undergoing transplant, definitely we can utilize the regenerative thing as an adjunct to the medical management when the patient is encountering hair fall or hair thinning or having the miniaturization due to DHT. So it stimulates hair follicles and promote hair growth in anagen phase. So now bit of it, previously already I have discussed the source, different sources and different potencies, which one is better. And these are the some tests which you should know something ki if anyone is visiting your clinic and sir, you use my exosome, this is that, and this is in Korea for last 20 years. You know, in abroad we have धूम मचा दी है, अब हम इंडिया में धूम मचाने आए हैं, हमारा exosome use कीजिए. This is how they come ना कि all the studies are there and they are having all those protocols and then they impose on the India कि तुम करो. This is the product which is made in India only, and I believe my country is best in the world. So stem cells, you have to the lab in our Delhi, it uses they adhere to the GMP guidelines which is set by the regulatory bodies like the WHO. The stem cells used should test negative for all the infectious disease. And regarding quality and quantity, we estimate the nanocyte tracking anti-analysis, which should be between 30 nanometer to 150 nanometer. Why this anti-analysis? I'll tell you a bit of it. See, we all know exosome primary is for communication. But in order to communicate, what I have to do? मैं कैलकाटा में बैठ के चैम्बर में बैठ के आपको आता नहीं, मेरे को कम्यूट करना पड़ा. So in order to commute, this NTA is very important. It has to travel, it has to move. Then only it can do its work. Then the best communication can happen. Then zeta potential assay, we see it should be between plus 20 to minus 20 millivolt. And very important thing, the CD markers. Any lot of exosomes, which by definition between 30 to 150 nanometer in size, and having 9, 63 and 81, and that too in more than 60% of the lot, is used for clinical practice. If it is less than that, the potency will not be up to the mark. And I'll say we are having a study also, they will tell you the papers also. We are having, our product is having more than 80% these CD markers. So that means they are definitely best. And total protein estimation, it has to be more than 30 microgram per deciliter. And we test the skin irritation potential and photoallergic potential. All the lots undergo all these tests. And once all these tests are satisfied, then only comes for the clinical packaging. And we are having now, yeah, please.
I've opened the kit for your reference.
Yeah, please. Yes. And what I am showing, or it's very less, there is no need to include this thing, but still you want to undergo what test that vial or that lot of vial has undergone. You can scan with your mobile, and you have all these things, including the certification license. And we have two formulations. This is just a license. Yeah.
This is what opens up on the QR code.
So do we have the other one also? So we have two vials, I'll say. The green one contains 10 billion molecules. So that is for the scalp. And the pink one contains 5 billion molecules, which is for the face. You can use anywhere. You can use in face, you can use in neck, decolletized area. You can use your hand, feet, knee, wherever you want. Clear? And as an adjunct, I hope we all are treating scars. We are doing rejuvenation with CO2 laser or microneedling, all those things. We all are doing. Hai na? In order to decrease the downtime, in order to have a better result, you can just smear the exosomes and you will see the downtime, redness, inflammation, and the result will be much better and expedited if you are adding as a sole treatment to the primary CO2 or a microneedling. Be for an stretch marks also we are doing a CO2 laser, or sometimes we are doing PRPs. So you can combine these things. Even you can inject also, though USA FDA has not given permission for exosomes to be injected anywhere, but across the globe people are injecting. What they recommend is that you just do microneedling. That means you create microchannels and you smear it so that they reach the target organ. But my question is that we all know the hair stem cells, they are at around 2.5 to 3 millimeter, the bulge area, and the other is at the dermal papilla, which is around 6 millimeter deeper. So by having a microneedling of 0.5, 1 or 2, how I will be reaching the target area? So on scalp, I 100% inject. Initially, when I started 2.5 years back, I was a bit skeptical. I was just doing this thing. I keep on microneedling. Na. It takes 20 minutes time to 10 ml or 8 ml to get absorbed. Some get wasted. and it's a costly thing also. So, and I was following many of the surgeons who were injecting, so I also started injecting. I am seeing a better result, and moreover, I am doing a worth to the patient, because investing so much amount to it, and then something is getting wasted on my hair shaft, which is of no use. Clear? So these are my few patients. This was a patient, I'll say. I'm not having the previous before pictures. He was having a typical miniaturized hair. These are after few sessions, I'll tell you. So he said, "Ki, Doctor Sahab, do hair transplant for me." He came for face rejuvenation. I was doing fillers, Botox and this. And he said, "Can you do something for me? I'm looking for a hair transplant." Then I saw he's having a miniaturized hair. I'll say, "Ki, I am having a one molecule. If you permit, I can inject and see." So I injected over the session, and this is the result after, I think so, 4 or 5 sessions. Is a before after, you see a total. Another patient, crown baldness, it respond really very poor to whatever the treatment you do. He has already undergone few sessions of PRP in another clinic. Then he came. Then I did exosome, and this was the result. But still he was saying, "Doctor, still दिखता है वहां पर, पता नहीं उनको क्या दिखता है." Then I say कि you stand on the earth, और तुमको चांद में छेद दिखता है, तुम I can't help. I can't help you on this. He is my teacher. So after fulfilling and establishing everything in his life, he said कि beta, ab now you do something. I want to spend whatever money I have there on me. So I did his hair transplant. And to my utter surprise, I told when he came, I think 6 months, मैंने कहा, "सर आपके ना कुछ बाल काले भी हो गए हैं." So this is something which came to my mind, and it is having everywhere result. This was an observation. It means even the gray hairs are turning black, and this happened in another patient of mine also. This patient of mine, he said he is having only 4 months time before her daughter is getting married, but I want a sure shot solution. So I said, I sure shot only one hair transplant I can do, but it takes around 6 months to show the result. So he said, I am a window period of only these 3 to 4 months. After that, no. Then I said, I have to do one thing then I will be doing repeatedly regenerative treatment. So I placed him 2 weekly sessions of exosome and GFC alternately. And in 3.5 months, this was the result. So, and again, you see the percentage, you can appreciate whether the graying has decreased or not. I'll say, he is saying, sir, my graying is bit less also. But this was the result. Another patient of mine, she was having this open pores, and she wants skin rejuvenation. She is pretty looking. I subjected her to microneedling, no injections on the face in her case, microneedling and exosomes, 4 sessions, and to my surprise, she was looking much brighter also. There was a reduction in the pore, skin is looking more glossy, more vibrant, and more reflective. In a profile, you can see. Another patient, same thing, only skin improvement she was looking for. Though I have done fillers also for her jawline. In a profile, another patient with melasma and active acne, I did both. And not very good, I'll say, some reduction was there. Another patient of mine, in 3 sessions, she was having a better reduction, I'll say. So, what norm I follow is that the schedule for hair, I subject my patient for injection 10 billion exosomes, monthly interval, minimum 4 sessions. Then depending upon the response, I subject them to 3 monthly or 4 monthly as a maintenance. Or if the affordability is less, I'll say you come once a year or twice a year, depending upon your maintenance. And you continue whatever the medical treatment is there. It cannot be exclusive treatment, because a hair fall or a hair loss is a multifactorial, isn't it? And for a skin also, I use the 5 billion one. Since it contains 5 ml and this contains 8 ml, it is containing a powdered lyophilized powder is there, along with the diluent is there. You mix with the diluent 8 ml for the hair, and for 5 ml for the face. So what I utilize, if I'm doing microneedling only, I include neck also. So what happens, it gives an extra benefit to the patient. So only microneedling, monthly interval, again 3 to 4 sessions depending upon the damage, and then maintenance. In scars, I inject also after doing microneedling, be it's a acne scar or stretch marks, I inject also. Apart from that, recently I have started doing on keloids and hypertrophic scar also, especially the younger ones where you can't inject because there is a limitation of total dose of kinacort. Either you have to focal treatment and give a gap, because there is a, you can't inject, no, there is a limit 1 milligram per kg body weight. So here I am using as a drug delivery device also, and combining with the exosomes. After applying topical cream, I am doing microneedling just to create micro channels and then smear the exosomes. I'll not say they are very promising, but definitely I am doing this study on keloids and hypertrophic scars. Let me do sufficient cases and then I'll come out with my own results. And that's my passion. I love doing cycling, and thank you.